Everyone, Assalamu alaikum. I would like to thank Prof. Salah and my colleague Dr. Ahmed for the invitation, as well as I'm happy to welcome all of you to Jeddah. Today I will speak about, this is my disclosure, about scoring balloons, and it's one of the strategies that we are treating the endovascular pathologies, and just to give an idea about how bad is the size of the problem. Many of us seeing this pathology in the clinic or through the on-call time, and the majority of these pathology, they are involving below or infrainguinal arteries, about 80 to 90%, while the other hand, the 20% is proximal to the inguinal ligament. So the concept of vessel preparation start to nowadays to be more clear, and it's to optimize the vessel internal structure and to avoid to prepare the vessel for the definitive treatment, including stent insertion or deployment. The key concept and the logic and scientific behind the vessel preparation is to reduce the vessel recoil, and by modifying the calcification of fibrotic lesion to limit the dissection and to ensure smoother and stable environment for the device deployment if we need it. In the market, fortunately, there is many machines doing this beautiful job for us. If you put it in categorize, like a rotational orbiter or laser atherectomy devices, we then have the intravascular lithotripsy, scoring balloons, shockwave therapy as another category, and drug coating balloon finally. The major problems that facing us and that might lead to the failure of the procedure has 4 elements mainly: recoil, restenosis, dissection, and calcification. As was mentioned before with my colleagues before me, in the recoil, elastic recoil is frequently observed in a critical limb ischemia patient undergoing tibial angioplasty. About 97% of the vessel has evidence of recoil 15 minutes after the procedure, while luminal compromise about 30% in 15 minutes from the procedure, and the recoil significantly contribute to restenosis. With the restenosis, about 2/3 of the tibial lesions tend to have restenosis in 3 to 6 months, and restenosis is a major problem for us because it's worsening the ambulatory status. If there is a wound, it affects the wound healing, and as well as resolution of the pain. With the dissection, angiographic evidence of dissection usually frequently observed, about 84% of the femoropopliteal angioplasties, and acute dissection may require more intervention or utilizing of the stent more frequently. About 3.5% when you have a dissection, there is an increased chance to put a re-intervention or put a stent. Dissection it can have many shapes and forms. It can be minor, it can be linear, it can have a spiral direction. It can usually has a very correlation with the lesion length as well as the balloon, the used balloon length. With atherosclerotic is still one of the major problem that we are facing, calcium deposition, and it has a problem with vessel remodeling. It has a problem of making the drug reach to the intima and adventitia, as well as it contributes to the failure of the procedure. It's interesting, yesterday I was working till late night in one case. Calcium actually ruptured the balloon twice. So calcium is bad thing that you are facing. I'm not sure this is moving. So again, elastic recoil, dissection, calcification, as well as the length of the balloon that you are using, or the length of the calcification and occluded segment, they are the main problem that we are facing during our procedure. And vessel preparation now start to be mandatory. One of the methods that we are helping us in vessel preparation to avoid complication and reduce the stenosis and the dissection is using a scoring balloon. This is really clear in this study when you can see the residual stenosis by using scoring balloons is better, and also the arterial dissection is less, and the utilization of the stent is less with using scoring balloons. The mechanism of action of these balloons, as there is many different types in the balloons, but the main mechanism of action is micro incision in the vessel wall that make the vessel more malleable for you, with help remodeling the vessel to go back to the normal status, anatomical status. Go back. In the market, there is many scoring balloons. Here, I collect some of these balloons with the specific feature that these balloons are recognized by. For example, from eye vascular, we have the hybrid balloon that coming with the scoring and cutting. From angiodynamic, they have the flexible balloons that is really good navigating through tertiary vessels. And from Boston, we have a cutting focus design, which is really good. And in my experience, really, I'm using mostly the UltraScore, which is integrated into all scoring element that's really give a good visibility. These balloons, they are safe, and the complication that might happen using these balloons are almost equal to any angioplasty procedure. The beautiful thing about using scoring balloon, it's evidence-based supported. And you can here see the evidence behind using the scoring balloon. It's up to a 2A, and it's a really good device to start with. And one advice when you are using a scoring balloon, please control inflation will help a lot of the success of the procedure, preventing the unnecessarily complication can be happened, and of course the sizing, pre-operative sizing of the balloon that you are using. Thank you.